Hi everyone, we are here at MaTOS Breast 2025 in Charlotte, North Carolina. We're here with Dr. Reddy. Hi, Doctor. How are you? It's a pleasure to be with you right now.
Thank you.
And thank you very much for your time. We would like to know a little bit about yourself.
Yes, so I'm Dr. Sangeetha Reddy. I'm at UT Southwestern Medical Center, where I'm a breast medical oncologist and a physician scientist focused on breast cancer immunotherapy and how to kickstart the immune system in these difficult to treat cancers. So I run a research laboratory and also design clinical trials focused on cancer immunotherapy.
Oh, that's fantastic.
And treat patients, which is an important part of the job. So,
I know that you were in the last panel. What are your two takeaways about those panels, the first ones of today?
So I was on the molecular tumor board panel where we had some very interesting case discussions on what to do in the case of patients whose tumors and blood test positive for ESR1 mutations and PIK3CA mutations and HER2 and somatic BRCA mutations. And I think the important part is that, we're testing these upfront, doing them in a longitudinal setting. I presented a case on serial ESR1 testing, so definitely there across lines of therapy, you see a significant increase in these mutations. And I think as we're coming up with better tools to be able to detect these, it's clinically becoming challenging of what do you do when you have co-occurring mutations. So the case we discussed earlier this morning was how would we treat when we have co-occurring ESR1 and PIK3CA mutations with different members on the panel, kind of prioritizing differently in that scenario. So I think important to look, and I think some of these future studies should address some of these more nuanced, how do we sequence these therapies, even in terms of targeted therapies when we're finding these somatic and other genomic abnormalities.
Yeah, the discussion was very interesting. Mm-hmm. What makes MaTOS different from other conferences that you have attended or presented at?
It's very intimate, which has been good. You have experts from around the country, maybe internationally, but maybe primarily country, here spending quality time together discussing the pressing questions, both in terms of clinical care and research and future directions. And I think the conference is both in terms of the structured, but also the unstructured environment set up to enable, facilitate that communication so we can brainstorm together and come up with new solutions for the future.
Yeah, that's fantastic. Thank you so much.
Of course.
I hope you enjoyed it today.
Yes, so far so good.